Hello everyone, welcome to my channel. In this video, we will discuss a question related to absence seizures. So we'll study what is absence seizure and what are some of the main clinical manifestations and how it is differentiated with the other type of seizures. We'll see the question first. A nurse is teaching the parent of a child who has a new diagnosis of absence seizures. Which statement by the parent indicates understanding of teaching? So here we are looking for a positive statement or a correct statement made by the parent of a child who is diagnosed with absence seizures. So whenever you will see a question that asks indicates understanding, which means the one who received the teaching, they understand correctly, and they will tell something that is shows a positive statement or that is a correct instruction which was taught by the nurse. So here we are looking for a good statement. We'll see the options. Option 1, my child may experience incontinence. Option 2, my child may seem confused afterwards. Option 3, my child may stare and seem inattentive. Option 4, my child will notice unusual odors prior to the event. So here we have 4 options, and what is our answer? And we will study what is absence seizure, then we'll come back to the question. So we'll get the answer. We'll see. Absence seizure, it occurs usually in children between the age of 4 and 12, and that usually disappeared at puberty. So that is the main first point, that usually will seen in child or children between the age of 4 and 12, and usually it will disappear at puberty. Then what are some of the clinical manifestations or classical features? There will be a brief loss of consciousness and an appearance of inattention or daydreaming. Like the child will be like stare, just looking. Sometimes we said that somebody is staring at me. Same like that, he will just look, and that will not last more than 10 seconds. Usually, this most absence seizures last less than 10 seconds and often go unrecognized. So that is the main clinical feature. So how it is? It will be with a brief loss of consciousness and an appearance of inattention or daydreaming, like an absence attack, and without a loss of postural body tone. So there will not be much loss in the normal postures or the body tone. However, there will be a slight loss of tone may related to dropping objects that is held in hand. If there is any object in the child hand during the time of seizure, that might be dropped down. That's it. But there will not be much body movements like other type of seizures. Then we already said that it will not be usually last more than 10 seconds. Usually it will be less than 10 seconds, and most of the time it might be unrecognized. Following an attack, behavior and awareness return immediately to normal. So this is, see, now the child experience like an 8-second absence seizure, and immediately after that the child will be come to the normal stage, immediately return to the normal stage. The child does not experience a post-ictal period. See, here is the point. In this type of seizure, the child will not experience a post-ictal period, which means after the seizure, and usually has no recollection that a seizure has occurred, and they are not going to recollect that the seizure has occurred. A child may have multiple absence seizures each day. See, here we already said that most of the time it is unrecognized, and child might have multiple episodes of absence seizures in a single day, because it is very less and there will not be much body posture changes, and sometimes the client will be, and most of the time they will be immediately returned to the normal. The treatment includes use of anticonvulsant medications. So what is our answer? Our answer is option 3. My child may stare and seem inattentive. So that is our answer, because here we said that the clinical manifestation is that loss of consciousness and child appear like inattention or daydreaming. So that's why our answer is child may stare and seem inattentive. Now we will see what are other options. My child may experience incontinence, option 1. See, these all other options that are usually will see in like a partial or a tonic-clonic seizures, like alteration in sensory perceptions, like awareness of odor or an aura. Previous before the seizure, the client, just prior to the seizure, the client has an experience of an aura stage. Then post-ictal confusion and incoordinateness, that are the clinical manifestations of complex partial or tonic-clonic seizures. So here we study what is clonic-tonic seizures, clinical manifestation, as well as the clinical features of absence seizures. I hope it's clear to you. So we'll come with some other question on the next video. Bye for now.